Hello everybody, myself Pavan Kumar and my greetings to Professor Jonas Caleb. I'd like to present regarding my critical examination on recent innovations in healthcare financing. Where there is an overview of value-based care, where value-based care is a healthcare delivery model that prioritizes the patient outcomes and the quality of care over the volume of services provided. Unlike the traditional fee-for-service model, where the providers are compensated for each treatment or procedure, value-based incentivizes the healthcare professional to focus on delivering the high-quality care that enhances the patient health. These shifts aim to improve the patient experience while effectively managing the healthcare costs. The key components of the value based care include a strong emphasis on the patient outcomes, ensuring that the care delivered leads to measurable healthcare improvements. And the cost efficiency is another critical aspect, as the VBC, the value based care, aims to reduce unnecessary services and hospital readmissions, which ultimately lowering the healthcare expenses for providers and patients too. Additionally, the provider accountability is a cornerstone for this model. Healthcare providers are held responsible for the quality of the care they deliver, and encouraging them to adopt the best practices and innovative approaches to the patient care. The primary purpose of the value-based care is to create more sustainable healthcare system that not only improves the quality of the care but also reduces the cost, making the healthcare professional and patients effective for all the patients. This transformative approach addresses the shortcomings traditional healthcare models. The changes addressed by the value-based care are the value-based care is integral to Shah and Shing system framework, which emphasizes the interconnections between the healthcare provider, patients, and payers. This model fosters the collaboration among these stakeholders to achieve the common health goals. One primary goal of the VBC is to enhance the quality of the care by aligning the incentives with the patient outcomes and promoting a focus on effective treatments and preventive measures. By emphasizing the quality over quantity, VBC seeks to reduce the unnecessary services and minimizes the hospital readmissions, ultimately improving the patient satisfaction and health outcomes. Additionally, the VBC shifts the financial risk to providers, encouraging them to responsibility over overall health of their patient population. This shift incentivizes the providers to adopt the innovative practices and prioritize the patient well-being, leading to a more efficient and accountable healthcare system. And also, by addressing these interconnected challenges, the value-based care aims to transform the healthcare landscape. There are like strengths and challenges, where the strengths are like improved patient satisfaction and outcomes and greater emphasis on preventive care, as the challenges include implementation complexities for providers, resistance to change from traditional models, and also need for the robust data analytics. While comparison to the previous approaches, the fee-for-service model emphasizes the quantity over quality, and in incentivizing the healthcare providers to deliver more service regardless of their necessity or effectiveness. This approach often leads to issues such as moral hazards, where the patient may overutilize the services, and market failure as the system fails to prioritize the patient outcomes. But in contrast, the VBC aligns the incentives with the patient outcomes, fostering a focus on quality and efficiency by rewarding the providers for improving health rather than merely increasing service volume. Also, the value based care aims to enhance the patient care and control costs. Additionally, promotes the social justice by improving the access to high quality care, ensuring that all the patients receive the appropriate treatment regardless of their socio-economic status. From an economic perspective, VBC addresses supply and demand by reducing this oversupply of unnecessary services while ensuring the high quality care is readily available for the patients. This shift creates more sustainable healthcare ecosystem, benefiting both patients and also the providers. And information interview sites, in an interview with a healthcare professional, they emphasized the VBC as a fundamentally transformed their practice. They also noted that VBC pushes us to focus on what truly matters, improving the patient outcomes rather than that of increasing the number of hospital visits. The professional highlight that the VBC has fostered culture of collaboration among the providers and encouraged a more provocative approach to the patient care. They also pointed out the challenges such as adapting to a new performance metrics and the need for the comprehensive data analytics. Overall, they believe VBC is a positive shift towards more accountable and patient-centered healthcare. But in conclusion, in my personal stance, value-based care presents numerous benefits and challenges as it seeks to transform the US healthcare system. This model emphasizes high-quality patient outcomes, promotes cost efficiency, and fosters accountability among healthcare providers. By aligning the financial incentives with the quality of the care delivered, VBC encourages the providers to focus on the preventive measures and patient-centered approaches, ultimately enhancing the overall healthcare experience. However, these challenges remain, including the complexity of implementation and the need of robust data systems and the resistance to change from traditional fee-for-service practices. And I strongly support the shift towards the value-based care as it address many of the shortcoming of previous healthcare models. Improved patient outcomes are the forefront of this model, ensuring that the care is not only effective but also equitable. Additionally, VBC contributes to most contaminant by reducing unnecessary services and hospital readmissions, creating more sustainable healthcare systems. Enhanced accountability fosters the best practices and innovation solutions by prioritizing the quality over quantity. Value-based care holds the potential and traditional healthcare to a system that better meets the needs of the patient while remaining financially viable. The evolution is essential for the future of healthcare in the United States. Thank you.